Hi, everybody. It's Roberta Heel. I am excited today to be interviewing Alison. We met about menopause over the concept of menopause and the issues related to menopause. And I'm really excited to hear her take on it. But I think to start, I'm going to ask Alison, can you give us a bit of a background? What do you do? How are you? What kind of work do you do? And how does it relate to menopause?
Absolutely. Yes. So I am a registered social worker, psychotherapist. So I've been doing that work for upwards of 30 years and seeing many different populations in private practice. And what I found recently with my own perimenopause journey was that there was a really huge gap in mental health support for women during perimenopause. So yes, and that's how Roberta and I met, getting some support. And just really, I decided to take a deeper dive into the work that my profession does to support women. And quite interestingly, there wasn't a lot of information. So, hence my deep dive into things. And as I've learned more, really learned how to apply my psychotherapist skills to help women with perimenopause. And I've really enjoyed that work.
You know what? This is great because so many of the patients I see, the women I see, not only struggle with hot flashes, we all know about that, but there are so many other symptoms associated with perimenopause. And this is where I'll get into some of the questions for you about this issue. What common emotional symptoms are associated with perimenopause?
Yeah, and it's a great question because I think most women who I treat the first session come and say, like, I don't know what's wrong with me. I
Mm.
think I'm in menopause. And yes, hot flashes is usually the textbook. I think I'm in menopause because I experience. However, most of the emotional health symptoms, that's where women experience a lot of distress because it just often dramatically impacts their coping and how they relate. So that's where I think therapy comes in, A, just to say, yes, this is okay, and B, to develop some tools. So the things that we're seeing are mood swings. So the hormone fluctuations, I would say like it's this up and down, irritability and anger. So many women saying, like, I don't even know why that came out of my mouth. Because you just feel sometimes taken over by a rage or just general irritability with things that you normally, fell off, brush off because it was no big deal. And then associated with that can be anxiety. So feelings of anxiety again around things that you normally were very confident in doing. And again, the intensity of that is really disturbing to a lot of women. Depression and low mood. So again, that's another common where many women who've not really experienced significant depressive syndromes are all of a sudden finding like I'm crying all the time, things really hurt, meaning emotional stuff, and just feeling like this low mood that is really difficult and sometimes impacting the ability to enjoy and feel joy. And then again, some of the maybe the more textbook, the fatigue and low energy. And again, oh, I'm aging. I'm not as quick as I used to be. But a lot of that is perimenopause, which again is really frustrating when suddenly you're not able to do things as well as you used to. Brain fog, probably another textbook one where again women are saying like I go to say something and the word doesn't come that I know.
Mhm.
And then again, all of this can lead to loss of motivation because you're not feeling well, you're not feeling like yourself. And then many women I deal with are perfectionists, type A, really can lose motivation because they're not doing things well and then just feel like I'm not even going to try, or it's just upsetting in the workplace when you're feeling like you're out of the loop because of all these symptoms. And then finally, again, another textbook can be sleep disturbances, which is something that many women complain, which again, they all kind of go together. You become anxious because you can't sleep, low mood, fatigue, obviously, brain fog. So they're all part and parcel. So those are probably the biggest ones that I see for sure.
Wow, you've really outlined some of the symptoms that I think all women going through perimenopause can relate to. But what can women expect then when coming to therapy to treat perimenopausal symptoms?
Yeah. And I mean, sometimes I'm finding that women, it's not the first place they go. So they go to a physician, they go to their OB and they say, yeah, like it'll pass, right? And that's where you come in. I mean, as someone who is from the medical system that actually listens. And therefore, that's where I think therapy comes in, because there's so much value in the validation and someone who actually understands it and is not dismissive of symptoms. That's one thing that I find many of my women that I treat say, oh, it's so nice to come and have somebody say they get it and not tell me to not worry about it, especially when it's had such a significant impact. So it related to that, again, going through those symptoms, the education, because again, I don't think we're well educated on perimenopause as women. I mean, other stages of women's health are, given a lot of attention. And then once you're past those childbearing years, it's like, well, I guess, again, hot flashes, it'll pass kind of narrative. So really trying to provide education and taking a deep dive into the symptoms is helpful. And then related to a lot of those symptoms, the irritability and anxiety, depression, is relearning or changing emotional regulation skills. So many women, again, come in and say, I don't know what's wrong with me. They're behaving in ways that are different for them. Sometimes they haven't developed skills because they haven't had to learn how to manage anxiety, learn how to manage low mood. So a lot of that, again, is very validating for women because the skills that they've used aren't working. So sometimes that rejig is really helpful. And again, anxiety and stress management, I think we all need that. But again, having a safe place to talk about the anxiety and how it's impacting, talk about the day-to-day stress that, again, you normally were able to roll with, having a place to kind of compartmentalize it, put things in place and say, it's not just you, and look at relationships and how they may be evolving with the symptoms. And then cognitive and memory support. So again, the brain fog thing, normalizing it. And again, often the brain fog also links to anxiety. So how do you calm yourself when you can't think of that word or something important, because it just becomes this, snowball down the hill, gaining momentum. And I think the biggest thing too is that all of that is the self-compassion and
Yeah.
understanding that you need to be kind to yourself through this. Many women, I think, well, anyone I treat in therapy, I always use the example of, if you had a broken leg, you wouldn't expect yourself to run. When
True.
we're experiencing all these emotional mental health symptoms, people continue to push themselves and say, I should, right? I always say you should yourself to death. I should be able to get past this. I should not yell at my kids. I should be able to sleep. All of these things, again, understanding that the self-compassion can kind of stop some of those snowball down the hill things with anxiety and low mood, because you're beating yourself up. And learning to take a pause is really, again, sounds very simple, but it's really a skill that many of us need to learn. And then looking at relationship support, learning how to educate and talk to the people who you love and who love you about what you're going through, because many well-intentioned people, our mothers, our sisters, it'll pass, I don't experience that. And I actually was talking to a woman the other day that said something really interesting, that among her friends group, there's almost like this shame thing around talking to other friends, that trusted friends, about symptoms, about like, I don't experience that, I'm not in menopause, like a denial. And is it fear of aging? Is it fear of, not holding it together? I think that's a really interesting thing to talk about in therapy, is how to have these conversations and own your symptoms and know how to ask for help. And yeah, really then the physiological stuff. Sometimes we do some cognitive behavioral stuff around the sleep, around what I call the reset or the foundation pieces, your hydration, your eating, things that you used to consume aren't agreeing with you. And I'm not the nutritionist or dietitian, but red wine is one that comes to mind, that many people say, I can't even. And just talking about how to modify those behaviors. They're not problematic drinking, but just learning where you've been using it to cope, or that you have to find something different because the physiological or the sleep stuff that happens with a lot of these things is not worth it. And then also, I think the other last thing is the impermanence of this. I think it can feel very catastrophic, because it is. And then learning that, again, it's not the, oh, this will pass, ride the wave. It's, this will not be permanent. We're going to teach some coping skills. And then optimistically, I want to say, well, how are we living the other half? What are the things that you want to take away from this experience? Sometimes it is about, living for today and not always running and doing things that to keep up. The self-care is probably the biggest thing that most women really want to incorporate into I call it the second half of their lives, because they want to be more intentional about caring for themselves, because up till them this time they really haven't.
No, that's right. Um, I watched many, many years ago, Jane Fonda was being interviewed and was asked what it was like to be in postmenopause. And she said it was great because the anxiety was gone. It's
Right.
like, wow, that rings so true to me. So you've already tapped into some of this, but just to give a better sense as to kind of things that are out there to help, what coping strategies do you recommend for managing mood swings or anxiety?
Yeah, and thankfully there are a lot of them. And again, for many women, they may be things they know about cognitively, but haven't actually practiced or had to practice.
Mhm.
So the one thing that I think I jokingly say gets the eye rolls is the mindfulness and deep breathing stuff. Because when you're in a, anger or rage, like that isn't going to work. But learning just to anticipate some of these situations and be conscious of your breathing, be conscious of the good things around you. So if you're going for a walk to calm, thinking about the sun on your face, the wind, the sound of your footfalls, just taking your mind off those symptoms that are really feeling like they're taking over. And again, when we're talking about things like anxiety, depression, how are you restructuring that in your head? So again, feeling hurt by someone's comment that they may have flippantly made because your emotions are so close to the surface. It's not saying don't do that or you have to own it. You have to own your feelings, but then learn how you could see it differently and not go down that pit of despair or anxiety. Um, Again, eye roll technique, routine, and structure. Just having, structured like bedtime and bed sleep hygiene is huge. Your nutrition, again, most of us run and grab something if we eat at all. And at this stage, learning that our blood sugar can get low, therefore irritable, angry, etc. Again, routine and structure is huge. And again, I think related to the mindful, maybe another eye roll is the grounding technique. So how do you kind of stop and put some space between that emotional reaction and what might come out of your mouth, and just, take a pause. um, Another eye roll, more physical activity. Those things that all the health professionals are saying, are you working out, are you hydrating? And then I think one of the big ones is the boundaries. So many women going through life, you need a piece of me, you need a piece of me, and really not honoring their own needs. So I really think one of the really big benefits and techniques we talk about is how you just say no. And I always say period at the end of the sentence. It's not no because la 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 la. It's no or no thanks. I don't
That's
think I'm not going
amazing.
to go to that. Just
What?
really, or hey kid, I know you know how to do that, and start really giving people that boundary that I'm not here to do all the things or make you happy. I'm here to take care of myself. I said sleep hygiene. Again, we know we don't function well when we're tired.
That's right.
And I know many women going through menopause, it's not just one night of bad sleep, it's a night after night after night, which we know causes a vicious cycle of going to bed, lying there, going, will I fall asleep tonight? What do I need to think about? What do I need to do tomorrow? And then all of a sudden, again, it's a vicious cycle of really poor sleep. And then last but not least, another eye roll, practicing gratitude. Um, it's easy to say, yes, we have lots to be thankful for. But I also want to underline, I don't like practicing gratitude in the form of comparative suffering, meaning people
Right.
have it worse than me.
Yeah.
Yeah, there's always going to be someone who has it worse than you, but how do you understand that yes, there are gifts, there are glimmers, I call them, in your life for sure. How do you try to notice them but not diminish the things that you're experiencing because you're ungrateful for what you have?
Okay. Those are amazing options for people. And just wondering then, how often should a person check in with a mental health professional during this phase of life?
It depends on the situation, but what I'm finding with women, again, they may have never come to therapy before. I'm happy that they've come. And for a lot of women, weekly sessions just to unpack and talk about the symptoms. And I always say, once you start therapy, it's kind of like if I told you to count yellow cars. All of a sudden, you see yellow cars. So when we start to talk about the symptoms and the impact, just noticing is usually a really huge eye opener for many women. So checking in on what you're noticing week to week for the first few weeks is really impactful. So you can kind of decide where you want to put energy into changes and how we can support the small wins that sometimes often have other symptoms kind of dissipate because you're focusing on one area that's causing you a lot of distress. And then we'll often move to biweekly or monthly sessions just to check in. And many women, I have many people I treat that I've seen for many years that do kind of a quarterly or a biannual check in with me just to say, like, hey, I want to remind myself that I have the skills. And that's really what I aim for, is that gradual reduction of sessions because your confidence in using the skills is building. And sometimes we can do a more intensive if women want, a couple of sessions a week, or a whole 2-hour session where we're talking about a whole bunch of things. That can be an option for sure, because sometimes the hour goes by really quickly. And one thing I love that a lot of people don't, I think I'm maybe a little afraid of, is group therapy. So I think there's so much power with perimenopausal women to be in the same space and know that other people are experiencing exactly the same symptoms and you're not quote unquote crazy. Because I have so many women that say, again, like I said earlier, people may be hesitant to share because there's a shame associated with it. You can get into a group of women that say, yes, that is exactly what is happening to me. You don't get that interaction as much with one-on-one therapy, and that cohesion in a group can be really, really powerful.
Oh, wow. That's great to know. So then finally, what should women do if they feel overwhelmed or unable to cope with their emotional health symptoms?
Again, sounds easy, hard for a lot of us. Ask for help.
Mm.
Knowing that, again, I think the narrative is, I can figure this out. I'm going to go it alone. We have Google. We have so many ways. I mean, and I'm just as guilty of it. How many things do you read and educate yourself before you reach out for help? I want women to know that therapy is helpful, and it doesn't have to be like you see in the movies. It's not lying on a couch. I don't have an Austrian accent. I don't use ink blots. It's about a genuine connection.
Okay.
And that is huge. The help is really a connection. It's not necessarily a life preserver. And talking to your healthcare professional. And again, sometimes what therapy helps with is learning how to become a self advocate with the doctor who's saying it'll pass, don't worry about it. Giving a language to the symptoms and saying, yeah, I don't buy that. Like, I don't think I'm feeling good enough to let this pass. I need support. So that can be huge, to just learn that you have a voice and take that voice. And then here's where I recommend you, if people come to see me first as a therapist and we talk about the medical support that they feel they've exhausted, that's where I say, where do you find a medical professional who will say, no, I hear you. Let's look at HRT. Let's look at some medication that would help you. Because I personally, I know you agree, let's try things without medication first. And most times when they're coming to you, Roberta, it's, I've tried all those things. And
Yeah.
that's where I want to validate to women, because I think some of the medication treatments associated with perimenopause are very misunderstood. And I think it's important. And mental health, I mean, antidepressants, anti-anxiety, there's a stigma associated with having to take them. And I think that's another thing where I like women to get education from someone who understands and is understanding the effects of medication, and knowing that that is not a sign of weakness, it's a sign of strength.
Yeah, it's
And then
true.
again, where can you find people, right? That, again, not all medical people are going to help you with that. So learn how to find the people.
Oh, that's right. And I like to say we'd never criticize somebody who had diabetes was taking their medication, or high blood pressure, but for some reason women who are suffering during the menopause transition and beyond just can't seem to catch a break sometimes with that kind, without getting criticized. But All right, so before we wrap up, this has been wonderful. I know that women will look for support in their own jurisdiction, but what if somebody was interested in working with you? How could they get in touch with you?
Sure. So I have a website. It's maratoscounseling.com. And I always encourage people, whether it's me or any other therapist, to go to the website. Most therapists have a really thorough profile so you can read about the person. Psychology Today is another place where you can read and see a video. So you can say, yeah, I like, doesn't matter the tone of their voice, their smile, they seem like they know what they're talking about. Bottom line is find a therapist who resonates with you. And again, it's a tough search, mental health treatment, perimenopause, but know that you will find somebody out there. And I'm in Ontario, and I'm getting licensed in Nova Scotia as well. So I think it's just really important to find a therapist. The other thing I do want to say as well is therapy is covered under most extended health benefits plans. So that's a bonus as well. So yeah, I think it's just, again, I wish there were more of us, but finding someone who's out there who is specialized in this area is really a big part of it.
Okay, well, thank you very much.
Thank you for having me.